Did you know that about half of all people assigned male at birth, AMAB over the age of 50, have an enlarged prostate, and that by the age of 80, this number rises to 90%? Enlarged prostate, also known as benign prostatic hyperplasia or BPH, is a common condition that affects many AMAB as they age. It can cause symptoms such as frequent urination, difficulty starting or stopping the urine flow, weak or interrupted urine stream, and urinary tract infections. These symptoms can interfere with your quality of life and lead to serious complications such as kidney damage, bladder stones, and urinary retention. If you are suffering from these symptoms, you may be wondering if there is a way to shrink your prostate without resorting to surgery or medication. Well, the good news is that there are some natural remedies that may help you reduce the size of your prostate and improve your urinary health. These include foods, vitamins, and lifestyle changes that can support your prostate health and prevent further enlargement. In this video, we will share with you the best natural remedies for enlarged prostate and how to use them effectively. We will also explain the causes and consequences of enlarged prostate and the conventional treatments available. So, if you want to learn how to shrink your prostate without surgery, stay tuned and watch this video till the end. But before we get into the details, please make sure to subscribe to our channel and hit the bell icon to get notified of our new videos. Also, this video is for informational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Always consult your doctor before trying any new remedy or changing your diet. The prostate is a small gland that helps make semen. It's found just below the bladder and surrounds the urethra, the tube that carries urine out of the body. The prostate often gets bigger as you get older. This is called benign prostatic hyperplasia, BPH, or enlarged prostate. BPH is not cancerous, but it can cause problems with urination and affect your health. The exact causes of BPH are not fully understood, but some factors may play a role. These include hormonal changes. As you age, the amount of testosterone in your blood decreases, leaving a higher proportion of estrogen. Studies suggest that estrogen may stimulate the growth of prostate cells. Genetic factors. BPH may run in families. If you have a close relative, such as a father or brother who has BPH, you may be more likely to develop it too. Metabolic syndrome. This is a group of conditions that increase your risk of heart disease, diabetes, and stroke. These conditions include high blood pressure, high blood sugar, high cholesterol, and obesity. Research shows that metabolic syndrome may be linked to BPH and lower urinary tract symptoms. Other health problems. Some diseases, such as diabetes, heart disease, and inflammation of the prostate, may also increase your risk of BPH. BPH can affect your health by causing symptoms that may bother you or interfere with your daily life. These symptoms include frequent or urgent need to urinate, especially at night, difficulty starting or stopping the urine flow, weak or interrupted urine stream, dribbling at the end of urination, feeling that the bladder is not completely empty, pain or burning when urinating, blood in the urine, urinary tract infections. If left untreated, BPH can also lead to serious complications, such as acute urinary retention. This is a sudden inability to urinate, which can be very painful and require immediate medical attention. Chronic urinary retention. This is a long-term inability to empty the bladder completely, which can cause urine to back up and damage the kidneys. Bladder stones. These are hard deposits of minerals and salts that form in the bladder due to stagnant urine. They can cause pain, infection, and bleeding. Bladder damage. This is a weakening of the bladder muscles due to overstretching and pressure from the urine. It can result in reduced bladder capacity and incontinence. Kidney damage. This is a loss of kidney function due to reduced blood flow and urine backup. It can lead to kidney failure and the need for dialysis or transplantation. Conventional treatments for enlarged prostate are the most common and widely available options for people who have moderate to severe symptoms of BPH. They include medications, surgery, and other procedures that aim to reduce the size of the prostate or relieve the pressure on the urethra. Each treatment has its own advantages and disadvantages, and the choice depends on various factors, such as the size of the prostate, the severity of the symptoms, the presence of other health conditions, and the personal preference of the patient. Here is a brief overview of the main conventional treatments for enlarged prostate and their risks and benefits. Medications. There are two main types of medications for enlarged prostate: alpha blockers and 5-alpha reductase inhibitors. Alpha blockers relax the muscles of the prostate and the bladder neck, allowing the urine to flow more easily. 5-alpha reductase inhibitors block the conversion of testosterone to dihydrotestosterone, a hormone that stimulates the growth of prostate cells. They can shrink the prostate by about 25% over 6 to 12 months. Some examples of alpha blockers are tamsulosin, alfuzosin, doxazosin, and terazosin. Some examples of 5-alpha reductase inhibitors are finasteride and dutasteride. Sometimes both types of medications are used together for better results. The benefits of medications are that they are easy to use, non-invasive, and effective for most people. The risks of medications are that they may cause side effects, such as dizziness, headache, fatigue, sexual dysfunction, and breast enlargement. Also, they may not work for everyone, especially those with very large prostates or severe symptoms. Additionally, some studies suggest that 5-alpha reductase inhibitors may be associated with a higher risk of high-grade prostate cancer, although this is controversial and not confirmed by other studies. Natural remedies for enlarged prostate are alternative or complementary options for people who have mild to moderate symptoms of BPH and prefer not to use medications, surgery, or other procedures. They include herbs, supplements, and lifestyle changes that may help improve the prostate health and reduce the inflammation, swelling, and growth of the prostate tissue. However, the evidence for the effectiveness and safety of these remedies is limited, inconsistent, or conflicting. Therefore, you should always consult your doctor before trying any natural remedy and use them with caution and moderation. Here are some of the most popular natural remedies for enlarged prostate and how they work. Saw palmetto. This is a small palm tree that grows in the southeastern United States. Its berries contain fatty acids and sterols that may inhibit the enzyme 5-alpha reductase and reduce the levels of dihydrotestosterone, the hormone that stimulates the growth of prostate cells. Saw palmetto may also have anti-inflammatory and anti-androgenic effects that may help relieve the symptoms of BPH. Saw palmetto is usually taken as a capsule, extract, or tea. The typical dose is 160 to 320 milligrams per day. The benefits of saw palmetto are that it is widely available, relatively inexpensive, and well tolerated by most people. The risks of saw palmetto are that it may cause side effects, such as nausea, vomiting, diarrhea, headache, dizziness, and sexual dysfunction. Also, it may interact with some medications, such as blood thinners, hormonal drugs, and anticoagulants. Moreover, it may not be effective for everyone, especially those with very large prostates or severe symptoms. Pygeum. This is an evergreen tree that grows in Africa. Its bark contains phytosterols, triterpenes, and ferulic acid that may have anti-inflammatory, anti-edematous, and anti-proliferative effects that may help shrink the prostate and improve the urinary function. Pygeum may also reduce the production of growth factors and prostaglandins that may stimulate the growth of prostate cells. Pygeum is usually taken as a capsule or extract. The typical dose is 100 to 200 milligrams per day. The benefits of Pygeum are that it is relatively safe and well tolerated by most people. The risks of Pygeum are that it may cause side effects, such as stomach upset, diarrhea, constipation, and headache. Stinging nettle. This is a plant that grows in Europe, Asia, and North America. Its root contains lignans, polysaccharides, and lectins that may bind to the sex hormone-binding globulin, SHBG, and reduce the levels of free testosterone and dihydrotestosterone, the hormones that stimulate the growth of prostate cells. Stinging nettle may also have anti-inflammatory and diuretic effects that may help ease the symptoms of BPH. Stinging nettle is usually taken as a capsule, extract, or tea. The typical dose is 300 to 600 milligrams per day. Eating a healthy diet that includes some fruits, vegetables, and healthy fats may support your prostate health and overall well-being. Certain foods such as salmon, tomatoes, and berries may be especially beneficial for your prostate, as they contain nutrients and antioxidants that may help prevent inflammation, oxidative stress, and cell damage in the prostate tissue. Here are some of the best foods to eat for prostate health and why. Salmon. This is a fatty fish that is rich in omega-3 fatty acids, which are essential for your health. Omega-3 fatty acids may help reduce inflammation, lower blood pressure, improve blood flow, and protect against cardiovascular disease. Some studies suggest that omega-3 fatty acids may also help prevent or slow down the growth of prostate cancer cells by modulating the expression of genes involved in cell cycle, apoptosis, and angiogenesis. Salmon is also a good source of protein, vitamin D, selenium, and zinc, which are important for your immune system, bone health, and prostate function. Tomatoes. These are fruits that contain a powerful antioxidant called lycopene, which gives them their red color. Lycopene may help protect your prostate from oxidative damage and inflammation, which are associated with BPH and prostate cancer. Lycopene may also inhibit the enzyme 5-alpha reductase, which converts testosterone to dihydrotestosterone, the hormone that stimulates the growth of prostate cells. Tomatoes are also rich in vitamin C, potassium, and fiber, which are good for your overall health. Berries. These are fruits that are loaded with antioxidants, such as anthocyanins, flavonoids, and vitamin C, which may help scavenge free radicals, reduce inflammation, and boost your immune system. Berries may also have anti-cancer effects, as they may modulate the signaling pathways involved in cell proliferation, differentiation, and apoptosis. Some of the best berries for your prostate health are blueberries, raspberries, strawberries, and cranberries, as they have high antioxidant capacity and phytochemical content. Broccoli. This is a cruciferous vegetable that contains many phytochemicals, such as sulforaphane, indole-3-carbonyl, and glucosinolates, that may have anti-inflammatory, anti-proliferative, and anti-carcinogenic effects on your prostate. These phytochemicals may induce the detoxification of carcinogens, inhibit the activation of nuclear factor kappa B, NF-κB, and modulate the expression of genes related to cell cycle, apoptosis, and angiogenesis. Broccoli is also a good source of vitamin C, vitamin K, folate, and fiber, which are essential for your health. Walnuts. These are nuts that are high in omega-3 fatty acids, polyphenols, and phytosterols, which may have beneficial effects on your prostate health. Omega-3 fatty acids may help reduce inflammation and prevent or slow down the growth of prostate cancer cells. Polyphenols may have antioxidant and anti-inflammatory properties, as well as modulate the activity of enzymes involved in hormone metabolism, such as aromatase and 5-alpha reductase. Phytosterols may help lower the levels of cholesterol and dihydrotestosterone, which may be associated with BPH and prostate cancer. Walnuts are also rich in protein, magnesium, selenium, and zinc, which are important for your prostate function and immune system. Just as some foods may help your prostate health, others may harm it or worsen your symptoms. These foods are usually high in saturated fat, sugar, salt, or additives, which can cause inflammation, oxidative stress, or hormonal imbalance in your body. Eating too much of these foods may increase your risk of developing BPH, prostate cancer, or other health problems. Here are some of the foods to avoid for prostate health and why. Red and processed meat. These foods are high in saturated fat, which can raise your cholesterol levels and increase inflammation in your body. Inflammation can damage your prostate cells and promote their growth. Processed meat, such as bacon, ham, sausage, and hot dogs, also contains nitrates, nitrites, and other preservatives, which can form carcinogens in your body. Carcinogens can damage your DNA and cause mutations that can lead to cancer. Studies suggest that eating a lot of red and processed meat may be associated with an increased risk of developing prostate cancer. Dairy products. These foods are also high in saturated fat, which can have the same effects as red and processed meat. Dairy products such as milk, cheese, yogurt, and butter also contain hormones such as estrogen and insulin like growth factor 1, IGF-1, which can stimulate the growth of prostate cells. Studies suggest that consuming a lot of dairy products may be associated with an increased risk of developing BPH and prostate cancer. Alcohol. Drinking alcohol can affect your prostate health in several ways. Alcohol can dehydrate you and irritate your bladder, which can worsen your urinary symptoms. Alcohol can also interfere with your liver function, which can affect your hormone metabolism and balance. Alcohol can also increase your blood pressure, which can affect your blood flow and oxygen delivery to your prostate. Saturated fats. These fats are found in animal products, such as meat, dairy, eggs, and butter, as well as in some plant oils, such as coconut and palm oil. Saturated fats can raise your cholesterol levels and increase inflammation in your body. Saturated fats can also affect your hormone levels, such as testosterone and dihydrotestosterone, which can stimulate the growth of prostate cells. In addition to eating a healthy diet, You may also consider taking some vitamins and supplements that may support your prostate health. These vitamins and supplements may provide some nutrients or benefits that may help prevent or reduce the inflammation, swelling, or growth of the prostate tissue. However, you should be aware that the scientific evidence for these vitamins and supplements is not conclusive or consistent. Therefore, you should always consult your doctor before taking any vitamin or supplement and use them with caution and moderation. Here are some of the vitamins and supplements that may be helpful for your prostate health and how much you should take. Vitamin D. This is a fat-soluble vitamin that is important for your bone health, immune system, and cell growth. Vitamin D may also have a protective effect on your prostate, as it may regulate the expression of genes involved in cell differentiation, apoptosis, and angiogenesis. Vitamin D may also modulate the activity of the vitamin D receptor, VDR, which is expressed in the prostate tissue and may influence the growth and function of the prostate cells. Some studies suggest that vitamin D may help lower the risk of developing BPH and prostate cancer. However, other studies suggest that vitamin D may have no effect or even increase the risk of prostate cancer. The recommended daily intake of vitamin D for men is 15 mcg, 600 IU. You can get vitamin D from sunlight exposure, foods such as fatty fish, egg yolks, and fortified milk, or from supplements. The upper limit of vitamin D intake is 100 mcg, 4000 IU, per day. Taking too much vitamin D can cause side effects such as nausea, vomiting, constipation, and kidney damage. Vitamin D can also interact with some medications, such as steroids, anticonvulsants, and weight loss drugs. Selenium. This is a trace mineral that is essential for your antioxidant defense, thyroid function, and DNA synthesis. Selenium may also play a role in your prostate health, as it may prevent oxidative damage and inflammation in the prostate tissue. Selenium may also inhibit the enzyme 5-alpha reductase, which converts testosterone to dihydrotestosterone, the hormone that stimulates the growth of prostate cells. Some studies suggest that selenium may help lower the risk of developing prostate cancer. However, other studies suggest that selenium may have no effect or even increase the risk of prostate cancer. The recommended daily intake of selenium for men is 55 mcg. You can get selenium from foods such as Brazil nuts, tuna, beef, chicken, and eggs, or from supplements. The upper limit of selenium intake is 400 mcg per day. Taking too much selenium can cause side effects, such as nausea, vomiting, diarrhea, hair loss, and nail damage. Selenium can also interact with some medications, such as blood thinners, anticoagulants, and chemotherapy drugs. Beta-sitosterol. This is a plant sterol that is found in many fruits, vegetables, nuts, and seeds. Beta-sitosterol may have a beneficial effect on your prostate, as it may bind to the androgen receptor and block the action of dihydrotestosterone, the hormone that stimulates the growth of prostate cells. Beta-sitosterol may also improve the bladder function and the quality of life of people with BPH. Some studies suggest that beta-sitosterol may improve the symptoms of BPH and reduce the prostate size. However, other studies suggest that beta-sitosterol may not be more effective than placebo in improving the symptoms of BPH or reducing the prostate size. The typical dose of beta-sitosterol is 60 to 130 milligrams per day. You can take beta-sitosterol as a capsule or tablet. Beta-sitosterol is generally safe and well tolerated by most people. However, it may cause side effects, such as indigestion, gas, diarrhea, and erectile dysfunction. Beta-sitosterol may also interact with some medications, such as blood thinners, anticoagulants, and cholesterol-lowering drugs. Besides eating a healthy diet and taking some vitamins and supplements, you can also make some lifestyle changes that may improve your prostate health and overall well-being. These lifestyle changes include exercise regularly. Physical activity can benefit your prostate health in several ways. It can help you maintain a healthy weight, lower your blood pressure, improve your blood flow, and reduce your stress levels. Exercise can also strengthen your pelvic floor muscles, which can help you control your urine flow and prevent leakage. Some studies suggest that exercise may also lower your risk of developing BPH and prostate cancer. You should aim for at least 150 minutes of moderate-intensity aerobic exercise, such as brisk walking, cycling, or swimming per week. You should also do some strength training, such as lifting weights or doing push-ups at least twice a week. You can also do some pelvic floor exercises, such as Kegels, to improve your bladder function and sexual performance. To do a Kegel, squeeze the muscles that you use to stop urinating for a few seconds, then relax. Repeat this 10 to 15 times, 3 times a day. Drink enough water. Staying hydrated is important for your prostate health, as it can help you flush out toxins and bacteria from your urinary tract and prevent infections. Water can also dilute your urine and make it less irritating to your bladder and prostate. You should drink enough water to keep your urine clear or pale yellow, which is about 6 to 8 glasses per day. However, you should avoid drinking too much water before bedtime, as it can cause you to wake up frequently to urinate at night. You should also limit your intake of caffeinated, alcoholic, and carbonated beverages, as they can dehydrate you and irritate your bladder and prostate. Quit smoking. Smoking can harm your prostate health in several ways. It can increase inflammation, oxidative stress, and DNA damage in your prostate tissue. It can also affect your hormone levels, blood vessels, and immune system. Smoking can also worsen your urinary symptoms, such as frequency, urgency, and incontinence. Some studies suggest that smoking may also increase your risk of developing BPH and prostate cancer. Quitting smoking can improve your prostate health and overall health. You can use various methods to quit smoking, such as nicotine patches, gums, lozenges, inhalers, or sprays. You can also seek counseling, support groups, or online programs to help you quit smoking. You can also talk to your doctor about prescription medications, such as bupropion or varenicline, that can help you quit smoking. Manage stress. Stress can affect your prostate health in several ways. It can increase inflammation, oxidative stress, and hormone imbalance in your body. It can also affect your mood, sleep, and sexual function. Stress can also worsen your urinary symptoms, such as frequency, urgency, and incontinence. Managing stress can improve your prostate health and overall health. You can use various techniques to manage stress, such as deep breathing, meditation, yoga, tai chi, or massage. You can also engage in hobbies, activities, or social interactions that make you happy and relaxed. You can also seek professional help, such as therapy or counseling, if you have chronic or severe stress. If you are undergoing treatment for enlarged prostate, you may wonder how to tell if your prostate is shrinking and if your symptoms are improving. There are some signs that may indicate that your prostate is shrinking and that your treatment is working. These signs include improved urine flow. One of the most noticeable signs of prostate shrinkage is an improvement in your urine flow. You may experience less difficulty starting or stopping the urine flow, less dribbling at the end of urination, and less feeling of incomplete bladder emptying. You may also notice that your urine stream is stronger and more continuous. You can measure your urine flow rate by using a device called a uroflowmeter, which records the volume and speed of your urine. You can also monitor your urine flow by timing how long it takes you to empty your bladder and comparing it with your previous records. Reduced urinary frequency and urgency. Another sign of prostate shrinkage is a reduction in your urinary frequency and urgency. You may feel less need to urinate frequently, especially at night. You may also feel less urge to urinate suddenly or uncontrollably. You can monitor your urinary frequency and urgency by keeping a diary of how often and when you urinate and how much urine you produce. You can also use a scale to rate your urinary urgency from 0, no urgency, to 5, extreme urgency. Improve quality of life. A sign of prostate shrinkage that may not be as obvious but equally important is an improvement in your quality of life. You may feel more comfortable, confident, and relaxed about your urinary health. You may also experience less pain, discomfort, or irritation when urinating. You may also enjoy better sexual function and satisfaction. You can monitor your quality of life by using a questionnaire, such as the International Prostate Symptom Score, IPSS, which assesses your urinary symptoms and their impact on your daily activities and well-being. Thank you for joining us on this journey to better prostate health. We've covered a lot of ground, from understanding the causes and treatments of an enlarged prostate to exploring natural remedies and lifestyle changes that can make a difference. Remember, taking proactive steps towards managing your prostate health can lead to significant improvements in your quality of life. If you found this video helpful, please give it a thumbs up and share it with others who might benefit from this information. Don't forget to subscribe to our channel for more insightful health content. Your support helps us grow and continue providing valuable resources. Hit the bell icon to stay updated on our latest videos.